Thank you for joining us, everyone. We'll get started in just a few minutes. Hi there, Dr. Pereira. I'm loading your slides. Just give me a minute.
Okay.
All right. Good afternoon, everyone. Thank you for joining the Los Angeles County Department of Public Health today, March 31st. Oh, I apologize.
Sorry.
Are you ready to go, Dr. Pereira?
I need a minute.
Oh, my apologies.
Oh, so sorry. Okay, we're good.
Not a problem. Thank you, everyone, for bearing with us. Today is March 31st. Thank you so much for joining us for a media briefing. Today we have Director of Public Health, Dr. Barbara Freire. I believe Supervisor Mitchell will be able to join us a little bit later. We're working on those technical difficulties. Dr. Freire, if you'd like to begin.
Yeah, thank you so much. And good afternoon, everyone. Thanks for joining today's briefing. I'll begin by sharing a status update, reviewing our current results for our early alert signals and preparedness measures, and suggesting sensible actions we can take to prevent the spread of BA.2. And hopefully Supervisor Mitchell will be able to join us and follow with remarks, and then we'll both respond to your questions. I'll take the first slide. We are about 2 months out from the peak of our winter surge, and we've seen significant declines in our cases, hospitalizations, and deaths, although it's important to note that our rates are leveling off and cases are no longer declining. Today, we're reporting 784 new cases. The average number of daily new cases reported over the last 7 days did decline slightly from a couple of weeks ago. But the most important thing, so we're averaging about 660 new cases a week now. The last time we averaged below 660 daily reported cases was back at the beginning of July. I think it was like July 9th of 2021. The 7-day average daily case rate, as you could see, is holds steady at 9 new cases per 100,000 residents. And while the number of cases trended, as I noted, somewhat downward over the last couple of weeks, the rate of decline has been slower, and this week we're actually not seeing any declines in the case rate. Daily test positivity inched up slightly to 1.1%, but as you can see, we've been at about 1% for a little while now. Hospitalizations, which is a key component of the CDC's community level measures, have continued to decline, and today we're reporting 308 people currently hospitalized with COVID-19. 2 weeks ago, that number was close to 500. Again, the last time the 7-day average hospitalization numbers fell below the current average of about 335 hospitalizations a day was back on July 10th of 2021. And with much relief, the daily reported deaths do continue to decline. We're now at an average of about 17 deaths a day. 2 weeks ago, we were at 34 deaths a day. Sadly, though, over the weekend, we reported an additional death of a child, bringing our total to 11 pediatric deaths in LA County. This reminds all of us of the very devastating consequences of this virus. And I do send my prayers and hope for comfort and peace to this child's family, along with all other families who are experiencing the loss of a loved one to COVID. Given that our cases, hospitalizations, and deaths have stabilized, starting this week, we'll no longer be reporting these metrics on the weekends. When we report on Monday, we'll separately present on Saturday, Sunday, and the Monday metrics. Next slide. As expected, given the daily metrics, our overall community level remains low this week based on the following indicators. The case rate for the past 7 days is the first indicator that's used by CDC to determine our community level. As of yesterday, LA County's case rate is 66 new cases per 100,000 people, and that remains below the CDC target of less than 200 new cases per 100,000 people in the last 7 days. The remaining 2 indicators that determine our community level, which are shown on this dashboard, are hospital metrics, and this serves as a proxy for the level of strain on the healthcare system. The first measure is the 7-day cumulative rate for new COVID-19 hospital admissions. Yesterday's rate of 2.6 admissions per 100,000 people meets the CDC criteria for the low community level. The second hospital indicator is the 7-day average for the proportion of staffed inpatient beds occupied by COVID-19 patients, and that's currently down to 2% for LA County. This is also considered to be in the low community level. Next slide. Our community level helps us understand how COVID-19 is impacting healthcare capacity in LA County, as well as the severity of disease. But as we previously noted, we've also identified a set of community-wide and sector-specific signals that alert us to possible issues that may indicate the need to realign our strategies in order to slow COVID transmission or prevent or contain outbreaks. These measures include 3 community-wide indicators: an indicator related to variants of concern, an indicator that tracks COVID-19 related emergency department visits, and an indicator that measures case rates in our lowest income areas. There are also 4 sector-specific indicators related to outbreaks. We actively monitor our early alert signals, and in instances where they indicate an area of concern, we'll consider opportunities to strengthen our preparedness efforts, refine or implement additional protective measures, and encourage our residents to take sensible steps to protect themselves and others. As you can see, for this week, all of our early alert signals are considered to be of low concern, except for the percentage of specimens sequenced that are identified as either a new variant of concern or a subvariant of concern. And for this metric, we actually indicate this week that we have high concern with this measure because we have 32% of recently sequenced samples in LA County identified as BA.2, and remember, BA.2 is designated subvariant of concern by the WHO. Next slide. We could look at the latest sequencing results so that you can get better information. You can see that Omicron is the predominant variant. It accounts for 100% of all of our cases with sequenced specimens collected in the week that ended March 12th. In LA County, although BA.1.1 remains the predominant lineage, the proportion of cases caused by BA.2 is increasing. For the week ending March 12th, BA.2 accounted for 32% of sequenced specimens, as I just noted. This is a doubling from the percentage that was identified for the prior week ending March 5th. As a reminder, this data represents sequencing results for specimens that were collected more than 2 weeks ago. And given that BA.2 is more infectious than the previous Omicron strains, we expect that BA.2 now accounts for an even higher proportion of COVID-19 cases in LA County. Increases in LA County do reflect patterns that are seen across the world, with the World Health Organization announcing last week that worldwide BA.2 accounted for 86% of sequenced cases from the prior 4 weeks. And on Tuesday, the CDC estimated that BA.2 is now the dominant variant in the United States, accounting for approximately 55% of sequenced cases for the week ending March 26th. While we're not yet seeing an increase in cases or hospitalizations in LA County, given the increased risk for spread of BA.2, it is important that we take steps now to maximize protection against spread. Encouragingly, The WHO reported that in countries with high levels of vaccination, especially among those most vulnerable to COVID-19, the recent increase in cases has not translated yet into high rates of hospitalizations or deaths. And while 75% of residents ages 5 and older in LA County are fully vaccinated, I do want to remind us that there are still 1.7 million LA County residents 5 and older that haven't yet received their first dose, and an additional 2.8 million eligible residents 12 and older that need their first booster dose, with booster coverage remaining disappointingly low in some of our hardest hit communities. These gaps in vaccination coverage create a lot of risk. We're doubling down on our efforts to ensure easy access to both accurate information and places to get vaccinated and boosted, recognizing that when case numbers are lower, getting vaccinated and boosted seems less important. The truth is that given the threat of a more infectious variant circulating widely across the county, those who are unvaccinated, those that aren't up to date on their boosters, those who are immunocompromised, those with underlying health conditions, and those with more exposures at work and in the community are at higher risk of getting infected, hospitalized, and even dying. So taking time now to get vaccinated and boosted not only protects the person that's going to get vaccinated, but it also reduces the risk of increased transmission across the county. Next slide. Sorry. As noted, although case rates of COVID-19 are lower now than during the surge in LA County, we do need to be prepared for the possibility that BA.2 or some other variant of concern could require additional interventions and mitigation. As I shared at our last briefing, we have identified 13 key metrics that assess our preparedness in the areas of outbreak management, testing, surveillance, vaccinations, and therapeutics. As you can see on this slide, we track our progress in those areas where we need to improve our preparedness capacity. Currently, our preparedness level is adequate or outstanding for all but one of our preparedness measures, the percentage of residents ages 12 and over in the most vulnerable communities who have had at least one additional or booster dose. Next slide. This slide shows the limited progress we've made increasing booster coverage in under-resourced communities. As of March 27th, about 37% of residents 12 and older who live in the most vulnerable communities received one or more additional or booster doses. While the rate increased by 10 percentage points since January 9th, it falls far short of the threshold level of 45% coverage with that additional dose, which is a rate that just represents better protection for both individuals and communities. As noted earlier, public health is working with our vaccination partners to take steps to speed the pace of vaccination and boosters. This includes ensuring that communities that are under-resourced and have been hard hit by the pandemic continue to have ready access to vaccinations in convenient nearby locations. Despite the lack of federal reimbursement now for vaccines for uninsured individuals, we've been able to maintain a robust network of over 700 mobile sites and additional fixed county vaccination sites where vaccines are offered at no charge to everyone. We're also providing boosters at community events, planning pop-up vaccination clinics at community sites, and partnering with schools and community-based organizations to offer vaccinations at priority sites. Our community health workers are canvassing in under-resourced communities to provide information and schedule vaccination appointments for residents. And we have staff that are now going door to door in neighborhoods that don't have a lot of vaccination coverage, and they're vaccinating individuals in their homes on the very same day. Also, with the recent approval on March 29th by the U.S. Food and Drug Administration for a second booster dose of either the Pfizer vaccine or the Moderna vaccines, as long as they're given at least 4 months after a first booster dose of any authorized or approved vaccine. And they're for individuals that are 50 years of age and older, and individuals who have undergone solid organ transplant, or they're living with conditions that cause a level of immunocompromise these vaccines that are the second booster dose now will provide additional protection for those that are at higher risk. We urge residents that aren't sure if they're eligible or whether they should get a second booster, or they have questions about the best timing given possible future surges, to discuss any questions with their providers. But if you are eligible for the second booster dose and you do want to increase your chances of not getting infected with COVID-19, you may want to go ahead and get that second booster dose now. If you don't have a provider or you have questions, please contact the Public Health Call Center at 833-540-0473. Public Health is offering second booster doses for free at all of our clinic sites, and residents can now check in with other sites, including pharmacies, to confirm availability. If you need help finding a convenient location for both vaccines and boosters, you can contact that same call center or go to vaccinatelacounty.com or vacunatelosangeles.com. Next slide. If we turn back to our preparedness dashboard, you'll see that for the remaining indicators, our preparedness level for each of the metrics was adequate or outstanding. We will continue to closely monitor these from week to week, and as needed, we'll refine our strategies and resources so that we can ensure that we're adequately prepared to respond to the next variant of concern, a surge, or any other challenge that puts residents and workers at risk. Next slide. Over the last several media briefings, I've presented on 4 of our 5 preparedness strategies. I've talked about vaccinations, testing, therapeutics, and outbreak management. So today I want to share some examples of how the 5th strategy, surveillance, strengthens our preparedness capacity. I've frequently discussed how sequencing can identify variants of concern that inform mitigation strategies. There are 2 other surveillance methods, wastewater surveillance and syndromic surveillance, that also help us understand our current state and provide early signals of changes. We're using syndromic surveillance to track emergency department visits for COVID-like illness. We aim to have 100% of emergency departments in LA County participating in this passive surveillance system. Currently, there are 81% of the facilities with emergency departments participate, and they provide us with regular, secure electronic data feeds that we use to identify emergency department visits that are associated with COVID-19 illness. Of note, as is the case for wastewater data, syndromic surveillance data can be particularly useful when there are low rates of community testing. This can happen when there's either limited access or we have large numbers of people testing via home test kits where results aren't reported to public health. Today, I'm sharing these 2 slides that show our ED syndromic surveillance data compared to first, as you see here, average cases, and then average hospitalizations. This slide shows the percentage of emergency department encounters that are classified as coronavirus related, that's shown by the blue line, compared to the 7-day average daily cases by report date, shown by the green line for the period of October 1st, 2021 through March 27th of 2022. This does include, as you can see clearly, our winter surge. You can see that while COVID-19 related emergency department encounters generally follow a similar trajectory to COVID-19 cases, the ED visits are generally higher than the case numbers when case numbers are relatively low, and that during the winter surge, the increase in the COVID-19 related ED visits started and peaked earlier than the increase in daily cases, which allows us to use this data as an early signal of the possibility that cases are starting to increase. The good news is that as of March 27th, as you can see here, only 3% of emergency department encounters are classified as COVID related. This is another positive sign of lower transmission, that despite the BA2 increases that we're starting to see, they're not resulting yet in increases in COVID-19 related ED visits. Next slide. This slide compares the percentage of emergency department encounters that are coronavirus related, again shown by the blue line, to a 7-day average for daily hospitalizations, which is shown by the yellow line. You see the same patterns here that we observed when comparing the emergency department data with the COVID-19 case data. The increase in coronavirus-related emergency department activity preceded the increase in COVID-19 hospitalizations, and ED activity reached its peak earlier and declined at a more gradual pace than hospitalizations. Currently, the percentage of patients in the emergency departments and hospitals is both below 5%. Next slide. The other surveillance system we review is what we call wastewater surveillance. This map shows the areas where wastewater collection and testing are being conducted at least 3 times a week by 3 agencies across the county. The areas where the LA City Sanitation and Environment conducts testing are shaded in red. The areas where the LA County Sanitation Districts test are shaded blue, and the areas where the Las Virgenes Municipal Water District conducts testing are shaded green. The black borders show the boundaries of our service planning areas. As you can see, sewer systems cover 7 of our 8 service planning areas. Unfortunately, currently there's no wastewater testing that's occurring in what we call service planning area 1, which is the Antelope Valley, but we are working to put that in place. It just takes a while to get these systems set up for this sampling. There are also several other areas that are not represented due to a variety of reasons. For instance, the area may have its own very small sanitation system that's actually not part of a sewer shed. It could be a municipality that doesn't have the capacity to or is elected not to participate in this surveillance system. That's usually because the area might be mostly served by septic systems, or the area may be a wilderness area. But data from the existing wastewater testing, which is very expansive in LA County, complements the data from all of our other COVID-19 surveillance systems. The wastewater testing can identify the presence of the SARS-CoV-2 virus shed by both symptomatic and asymptomatic people. And unlike some of our other surveillance methods, it doesn't require that someone be tested for COVID-19. Wastewater analysis may be particularly useful at times when testing is not readily available or it's underutilized. Currently, there's ample access to testing in LA County. However, as more residents are using home test kits, this wastewater analysis could become a very valuable complement to our other surveillance systems. Next slide. These next 3 slides are going to show recent wastewater sampling results compared to LA County COVID-19 cases for the 3 entities that are conducting wastewater collection and testing in our county. Results from all 3 sewer sheds that are included in this analysis are consistent with findings from our other surveillance systems, and none of the findings suggest any concerning signals. There are several data limitations that I just want to note from the onset. First, each of these entities uses different collection and sampling methods, so the results aren't really easily compared. In addition, and that's why we don't put them all on one table. In addition, they don't reflect real-time results since the latest data points are from around 2 weeks ago. And finally, since single observation points are presented, there can be a lot of variability, and individual data points therefore are going to need to be interpreted with some caution. The first slide shows the results from the LA County Sanitation District, which covers the areas of South, Southeast, and East LA. The gray shading represents the 7-day average for LA County new cases. And this is looking from April of 2020 all the way through March 16th of 2022. And the blue line shows the SARS-CoV-2 concentration in wastewater for the same period. You can see that the wastewater results generally are tracking with cases. And at this time, we don't see any significant concentration of SARS-CoV-2 in the wastewater for these communities. Next slide. The next slide shows the results from the LA City Sanitation Environment Agency, which covers some of central LA County, parts of the San Fernando Valley, and West LA. The gray shading represents the 7-day average for new cases from September 20th of 2021 through March 16th of 2022. And the orange line shows the SARS-CoV-2 concentration in wastewater for the same period. As you can see, in early December 2021, we did start to see a steady increase in the SARS-CoV-2 concentration in wastewater, which was followed about 2 weeks later by corresponding increases in cases. Thus, the wastewater data provided us with an early indication of possible increases in transmission. There's been a lot of variation in wastewater concentration that was noted over the first 2 weeks in March. And it's unclear to us right now if this is really an upward trend, because the average concentration over the second week in March was actually a little bit lower than it was for the first week of the month. So we're going to continue to monitor, and if we see these continued increases, it may provide us with an early alert of cases could soon be rising. Next slide. This is the third slide, and it shows the results from the Los Vírgenes Municipal Water District. This covers parts of West Valley. It does show cases again versus wastewater concentration. This is from January 27th of 2022 through March 17th of 2022. As cases declined, wastewater concentration, as you can see, was following a similar pattern, including the fact that now we had these small upticks again in mid-March. This is a very small district. We don't have enough data at this point to draw a definitive conclusion regarding a possible increase. But again, we continue to monitor the results from this district along with the data from the other two agencies that are conducting testing, and we'll always present any notable findings. Go on to the next slide. While we're fortunate that our cases, hospitalizations, and deaths remain relatively low in LA County, the international situation bears watching, and changing conditions across the globe require attention. Per the World Health Organization, for the first time since January, worldwide COVID-19 cases increased for 2 consecutive weeks in March. As you can see from this map, which shows average daily cases per 100,000 population, COVID-19 cases are increasing across various regions of the world. Some of the areas that are experiencing the higher rates, which are shaded in purple, include Australia, parts of the Western Pacific, and much of Europe. The WHO noted that BA2, which is more transmissible, as we've noted, than BA.1, is sweeping the globe, and that upticks in cases can be considered in the context of a more transmissible variant and the lifting in many countries of public health and social measures that were slowing COVID transmission. Sadly, the WHO also reported last week that some countries are seeing their highest death rates since the beginning of the pandemic, which they noted reflects the speed at which Omicron spreads and the increased mortality risk among the unvaccinated, particularly among older adults. For this reason, we do continue to closely monitor the early alert signals and the preparedness measures, and when needed, we'll have to adjust our strategies to address areas of moderate or high concern. Next slide. Given the increase in cases across the globe, the increase in cases across some parts of the country, including New York City, and the increased circulation of BA.2, this is an appropriate time for everyone to use the tools at hand to increase levels of protection that can decrease both personal and community risk. We recommend the 4 following sensible actions to curb the spread of BA.2. First, as noted earlier, we strongly recommend that anyone that's not fully vaccinated and boosted get their primary series and/or their booster doses as soon as possible. Our local data, which is consistent with the national data, show that being fully vaccinated provides very strong protection against COVID-19, including the Omicron variant, and that people who are best protected from COVID-19 infection and severe illness are those that are fully vaccinated and had a booster dose. For instance, for the week ending March 18th, individuals who were fully vaccinated but hadn't yet received a booster were about 3 times less likely to be hospitalized with COVID-19 than unvaccinated individuals. However, those who were fully vaccinated and had a booster dose were even more protected. They were about 6 times less likely to be hospitalized against COVID than those who were unvaccinated. It does take time to build up immunity from vaccinations and booster doses. So please get vaccinated and boosted at one of our convenient vaccination sites as soon as you can if you're not already up to date and boosted. Next, if you can't be vaccinated due to medical reasons or because your body isn't going to mount an appropriate immune response to the vaccines, you can still get some protection You should ask your provider if you're eligible to receive Evusheld. This is a new therapeutic for people 12 years and older that can prevent COVID-19. There are also several therapeutics that are available that can reduce severe illness for people who have been infected with COVID-19. It's very appropriate to figure out now if you would be eligible for the new therapeutics and to have a plan about how you would access these medicines. Be a great time to discuss with your provider whether you're a good candidate for one of the new therapeutics should you test positive. And if you're in the small group of people that are testing positive right now, we ask that you please check immediately with your provider about your eligibility to receive one of these treatments. Another important step that we're asking people to take is to make sure you have an ample supply of the over-the-counter, these in-home test kits that you can administer yourself in the privacy of your home. You can order up to 2 sets of 4 at-home test kits at no charge from the federal government at www.covidtest.gov. If you have health insurance, you can receive 8 free at-home tests every month for each insured member in your household. Obtain these kits now so you can easily test yourself whenever you feel sick or you were in close contact with someone who tested positive, or when you're gathering with folks who may be at elevated risk. The quicker you know your status, the less likely it is that you'll infect others. You can also get tested at one of the many free testing sites located throughout the county. So visit www.ph.lacounty.gov/COVID-tests for more information and links to testing sites that are free. And of course, if you're sick, you test positive, or you're exposed to someone with COVID-19, please stay home and away from others to prevent COVID-19 from spreading in your home, in our work sites, in our schools, and in our communities. And the final action that you could take is to wear a mask indoors in public places, especially if you or others you'll be in contact with are not fully vaccinated, they're elderly, immunocompromised, or have serious underlying health conditions. Masking remains one of the easiest and effective things we can do to protect ourselves and others from COVID-19. If we all take these reasonable steps, I'm confident that we can continue to reduce the spread of COVID-19 in communities across the county. Thank you. And was Supervisor Mitchell able to join us?
We're having a couple of difficulties. If you give us a second, once I take down the slides, and we're going to see if we can add her.
Okay, wonderful. So if you'll just bear with us, we're going to try to make sure the supervisor can get on.
Many apologies. We are speaking with her staff at the moment, Dr. Freer. Apparently she's having trouble with the platform because the meeting has already started. So we're still speaking with her. Do you want to go ahead and take a first question while we're waiting, or do you want to give it another minute?
No, we can go ahead and, we'll take a first question. Hopefully we can get this sorted.
Okay, all right. Let me load that up here. My apologies, everyone. Our first question is going to come from Margaret Carrero. Margaret, you're unmuted. Go ahead.
Thank you so much, Dr. Ferrer. Happy Thursday to you. Thank you for taking our questions. You mentioned at the very top the idea of cases leveling off. We're not seeing things decline at this point. What does that say to you, and is that of concern?
Yeah, thank you so much, Margaret. I'm not sure that I would say this is of concern. I think it's notable. At some point we knew that it was likely we were going to stop declining because we know that there's still transmission. We know that there's still people who are getting exposed. Personally, I wish we were at a lower level when we're doing this plateauing. But we have, seen a significant decrease, and that is the good news. Our case numbers are relatively modest at the moment. But you can see by my advice that I think we need to still be cautious because there's enough transmission going on. We're not anywhere near having low transmission. That folks need to be careful. And that's particularly true for those folks who are at elevated risk. So, it would be good if we could have continued or could get back to continuing to see a decline. But we've always noted that every single time we have reduced the restrictions or the levels of protection that are required, we have always seen an uptick. I think, sort of the slowing of the decline can also be seen in some ways as an uptick. Our job right now is to make sure that this doesn't lead to a significant increase in cases, because that really would be in some ways a step that I think is avoidable.
Thank you so much. It appears that we are unable to get her on board, and I do apologize. Our next question comes from Ron Lynn from the LA Times. Ron, go ahead.
Hi, Dr. Ferrer. Thanks so much for chatting with us. Really appreciate it. Our questions today are about Congress, a crystal ball question, and long COVID. So first, given Congress's lack of funding for programs for vaccines, anti-COVID medicines, and testing, can you describe what effect that's having in LA County? Is it causing problems already? Second, you noted a lot of good news today, and also that in countries with high levels of vaccination, the increase in cases has not translated into high rates of hospitalization or deaths. Do you think LA County has reached that high level of vaccination? And, what are the range of scenarios you're suspecting are likely to happen in the next few months? Do you think it's likely we'll see a major increase in cases, hospitalizations, and deaths, or not? And then finally, while there are, people who are ready to be done about worrying about getting infected, some researchers have been warning about long COVID as affecting a relatively significant number of people, and are also warning about new potential side effects of surviving COVID, such as diabetes, heart trouble, and brain shrinkage. Are you seeing an increase in reports of long COVID following the winter Omicron surge, and is long COVID still something to worry about? Thank you.
Yeah, thanks so much. Let me start with the last question, because I think it's a really important question. There's no national database that's tracking long COVID, and I think we're working hard. We're one of many sites that are trying to be part of a surveillance study that would allow us actually moving forward to collect good information about long COVID. We think it's super important to better understand the impact of prolonged disease associated with a SARS-CoV-2 infection. So we worry a lot about long COVID. I mean, many people say to me, I don't know why you're so worried still. Like, why do you keep your mask on? And, I don't really want to get COVID, and I don't want to get long COVID. And I know many people who have, unfortunately, had lingering effects after an infection. So I think it is something to be concerned about. And I think it's one of the reasons why we say, we don't really know with all certainty what the burden of disease is that's associated with COVID. And like you said, new studies around both diabetes and heart disease are really should give all of us another reason to double down on efforts to avoid getting infected as much as possible. I mean, obviously, none of our strategies for avoiding infection are perfect, so you cannot reduce risk to zero, but it is a good reminder, particularly for those people who are at elevated risk of having more severe outcomes, that you should continue to do as much as you can, even if you're tired of this pandemic, to avoid getting infected and to avoid infecting others as well. So it's why we still recommend that everyone keep those masks on in those public places. Lots of workers there, some of them extraordinarily vulnerable to a bad outcome should they get infected. So let's continue to remember, just like you said, that we don't know enough about long COVID, and when you don't know enough about something, you should be extra cautious, not less cautious. I mean, that would be my strategy. In terms of what are we worrying about in terms of the lack of funding from Congress, first, and my hope is that Congress fixes this and fixes this soon. I mean, it really is shameful in the middle of a pandemic that we're all worrying about not having enough money to make sure that those folks with the least resources are going to have good access to what it takes to add on layers of protection from COVID. And right now, you mentioned three of those: vaccines, therapeutics, and testing. We want to also make sure we've got good access to PPE. We should have learned a lot of lessons by now. And one of them is we can't have interruptions in the supply chain. And the other one is that we're interconnected. And if some people in our community don't have good access to vaccines, therapeutics, and testing, we increase the risk for everyone in the community. So right now here in LA County, we're doing everything we can to make sure that we can continue to have good access to vaccines, therapeutics, testing, that we have no interruptions in the supply line for PPE. But it's, our capacity to do this is going to, run out the longer it is before we get additional federal resources. So, I urge our congressional folks, our elected officials, to do everything they can to recognize that in the middle of a pandemic, we don't play politics with lives and livelihoods. And we need this money to ensure that we're keeping all of our systems in place to make it very easy for people to have the protections that save lives in the middle of the pandemic. And the last question is, the crystal ball question, what do I think is going to happen? Do we have enough people vaccinated? I think, unfortunately, the answer on, sort of, do we have enough people vaccinated is probably not. And the biggest worry right now is we certainly don't have enough people boosted. It's hard to understand the hesitancy for people not to come in quickly and get that booster dose. Evidence all over the world shows waning protection from the vaccines over time. People who are at higher risk, people who are older, people who have underlying health conditions, don't delay in hopes that, we're going to have a better booster vaccine, available, next month, or that it would be better to just do this when cases are high again. We have enough transmission that you don't really want to be increasing your risk. And the same goes for the people who are now eligible for the second booster dose. I hear a lot, I'm just going to wait. I think, there's going to be something better. I don't want to keep getting a shot every 4 months. But if there's waning protection and you can get a shot that actually boosts your protection and you're a person at higher or elevated risk, makes sense to go ahead and get that booster dose. So I think unless we can get more people certainly up to date on their vaccine coverage and bring in more of the folks who have not yet come in to get vaccinated, we still have a lot of risk, as I noted today. We just have millions of people that don't have optimal coverage right now. And for all the folks also who, did get infected with Omicron and are feeling like they have some natural immunity, that is true. But that natural immunity also wanes over time. And we've just witnessed that people who were infected with Delta didn't end up having a lot of immunity to Omicron. So, I would urge people again, go ahead, get vaccinated, even if you were infected, because it really helps ensure your immune system is able to respond most effectively against the threats of circulating strains of this virus. So thanks, Ron.
Our next question comes from Jackie Fortier from KPCC. Jackie, you're unmuted.
Hi there. Thanks for taking our questions. Can you describe, please, what you do with the information from the wastewater detection or from the emergency departments? I mean, I guess it seems like there's kind of a disconnect. Like we see potentially, more viral load, for example, in wastewater, and that might be a week before, cases start increasing. But it's not like hospitals can staff up nurses or something in a week. What do you do with that information when you see it rise? Thank you.
Oh, thanks, Jackie. That's a great question. So the reason for the early alerts is so that we avoid the hospitals needing to staff up, to be honest. I mean, in other words, if you had enough signals going off, let's say we have, BA2 definitely dominating, circulating. We know it's at least 30% more infectious than BA.1, BA.11. And we start seeing early signals that wastewater is showing higher concentrations of people with the virus, and our EDs are starting to see, again, more cases. It's an indication to us to take a look at protective measures, mitigation measures, and make decisions about where we may want to introduce more protection measures, more protective measures. So, obviously masking is one, but also, increasing testing, making sure, we're going back to doing more routine testing at places at higher risk. So I think the whole effort with the early alerts is to get in front of having our cases go up so high that it will in fact create stress for the healthcare system. It's really an important part of our way of staying prepared is to make sure we have that capacity to go ahead with other mitigation efforts that will quickly help us, hopefully, get back to slowing spread without waiting for the hospital system to already be stressed.
Our final question comes from Marla Tejas from Fox 11. Marla, go ahead.
Hello, Dr. Ferrer. Thank you so much. This is in line with what you're just saying, and this may be a little repetitive. It's the crystal ball. It's the idea that we've just doubled with BA2 and more than 30% now. In next week briefing, if we are in line with the national trend of that more like 55% and above, and in fact, hospitalizations are rising, God forbid. Do you foresee going backward with restrictions? Number one. Number two, at the same time, we've come a long way. Most of the restrictions have been lifted. We are seemingly living with it. Are we in the endemic phase? What does that look like? What will it take for us to get there? Thank you.
Yeah, thanks so much, Marla. Great questions. I never think of us going backward when we make decisions that it's important to introduce mitigation efforts again. I think of that as like sort of living with COVID and accepting the fact that we're likely at different points of time to see increases in cases. And then, fortunately for us, a resource-rich country, we have opportunities to use both the existing tools, but we seem to also get new tools to help us then dampen spread. So, I don't see it going backwards. And I think, it's helpful if none of us look at it as going backwards and instead look at it as like, we're very lucky we have such a rich toolkit that we can, in fact, use all these strategies to help us continue to keep our economy open and to continue allowing everybody to enjoy as much as possible all of the activities that we want to engage in. And, I think that's the goal is how do we stay open and how do we stay safe? How do we keep workers safe? How do we keep our schools open without a lot of cases? And that will require, when transmission goes higher, that will require reintroducing some of the classic mitigation efforts that we know help reduce spread. Masking is one of those, testing is another one, continuing to make it easy for people to get vaccinated and boosted, and making sure people understand why those vaccines and booster doses remain so important, and now building out the network for therapeutics, all of which should help us avoid stressing out the healthcare system, because that is one of the goals. We don't want to disrupt sort of the customary lives, but we also don't want to get to a place like we got during Omicron, like we got during the previous surges, particularly the winter before surge, where our hospitals, frankly, were too stressed and were unable to do their customary procedures and services. So it wasn't just people with COVID that got affected, people with heart attacks, it was people who needed surgeries, it was people who were in car accidents. So, you know, my sense is we're on a journey, learning, just like you said, how to live with this this particular coronavirus, SARS-CoV-2. I think we've got a lot of tools in the toolkit, but I do anticipate, because viruses mutate, that we'll need to be revisiting strategies as we go along this journey to help us make sure that we're protecting each other, our healthcare system, and our ability to sort of lead our customary lives. So hopefully that was a good answer for those questions.
That concludes our question and answer period. Any final remarks, Dr. Ferrer?
No, I'm just super sorry that we weren't able to hear from Supervisor Mitchell, and apologize to everyone. You know, hopefully that doesn't happen again next week. We'll work to really figure out what the technical issues were. And again, thank you everyone for all you're doing and all the reporting. Much appreciated.
For any additional questions from the media, you can send them to our media inbox at media@ph.lacounty.gov. And if you stick around, our Spanish remarks will be in just a few minutes. Thank you. Hi there, Monica. Are you ready to get started?
Yes, I'm here.
Okay. Thank you so much, everyone, for joining us today, March 31st, for the media briefing for the Department of Public Health. We have Monica speaking. Monica, when you are ready.
Thank you so much, Kim. Muy buenas tardes y gracias por unirse hoy a la sesión informativa donde comenzaremos compartiendo una actualización del estado. Revisaremos nuestros resultados actuales para nuestras señales de alerta temprana y medidas de preparación y sugiriendo medidas sensatas que podemos tomar para evitar la propagación de BA.2. First slide, please. Estamos a unos 2 meses de haber superado el pico de nuestro aumento de casos durante el invierno y hemos visto disminuciones significativas en nuestros casos, hospitalizaciones y muertes, aunque es importante tener en cuenta que las tasas se han estabilizado y los casos ya están disminuyendo. Hoy estamos reportando 784 nuevos casos. El número promedio de casos nuevos diarios informados durante los últimos 7 días se redujo a un promedio de 660 desde los 950 casos nuevos diarios de hace 2 semanas. La última vez que promediamos menos de 666 casos diarios informados fue el 9 de julio de 2021. Nuestra tasa de casos diarios promedio de 7 días es de 9 casos nuevos por cada 100,000 residentes. Sin embargo, aunque el número de casos mostró una tendencia a la baja, la semana pasada la tasa de disminución fue más lenta y esta semana los casos ya no están disminuyendo. Nuestra tasa de positividad de la prueba diaria se mantiene baja en 1,1%. Las hospitalizaciones, un componente clave de las medidas de nivel comunitario de los CDC, han seguido disminuyendo y hoy informamos que 308 personas están hospitalizadas con COVID-19 en comparación con 495 hace 2 semanas. La última vez que el promedio de hospitalizaciones de 7 días cayó por debajo de nuestro promedio actual de 335 hospitalizaciones fue el 10 de julio de 2021. Y con mucho alivio, los decesos diarios reportados continuaron disminuyendo a un promedio de 17 muertes al día, frente a un promedio de 34 muertes al día hace 2 semanas. Sin embargo, lamentablemente, durante el fin de semana, informamos la muerte adicional de un niño, lo que eleva nuestro número total de muertes de niños a 11 en el condado de Los Ángeles, lo que nos recuerda a todos las devastadoras consecuencias de este virus. Enviamos nuestras condolencias a la familia de este niño y a todas las demás familias que están de luto por la pérdida de un ser querido a causa del COVID. Dado que nuestros casos, hospitalizaciones y muertes se han estabilizado, a partir de esta semana ya no informaremos estas métricas los fines de semana. Cuando hagamos el reporte el lunes, presentaremos por separado las métricas del sábado, el domingo y el lunes. Next slide, please. Como era de esperar, dadas las métricas diarias, nuestro nivel comunitario general sigue siendo bajo esta semana según los siguientes indicadores. La tasa de casos de los últimos 7 días es el primer indicador que utiliza el CDC para determinar nuestro nivel comunitario. Ayer la tasa de casos del condado de Los Ángeles era de 66 casos nuevos por cada 100,000 habitantes, que se mantiene por debajo del objetivo de los CDC de menos de 200 casos nuevos por cada 100,000 habitantes en los últimos 7 días. Los indicadores restantes que determinan nuestro nivel de comunidad que se muestran en el tablero son métricas de los hospitales que sirven como representación del nivel de tensión en el sistema de atención médica. El primero es la tasa acumulada de 7 días para nuevas admisiones hospitalarias por COVID-19. La tasa de ayer de 2,6 ingresos por cada 100,000 habitantes cumple con los criterios de los CDC para el nivel comunitario bajo. El segundo indicador hospitalario es el promedio de 7 días para la proporción de camas ocupadas por pacientes con COVID-19 y que cuentan con personal para atenderlas, que es actualmente 2% para el condado de Los Ángeles. Estos también se consideran el nivel comunitario bajo. Next slide, please. Nuestro nivel comunitario nos ayuda a comprender cómo COVID-19 está afectando la capacidad de atención médica en el condado de Los Ángeles, así como la gravedad de la enfermedad. Como se señaló anteriormente, también hemos identificado un conjunto de señales específicas por sector y la comunidad en general que nos alertarán sobre posibles problemas que pueden indicar la necesidad de realinear nuestras estrategias con el fin de desacelerar la transmisión de COVID-19 o prevenir o contener brotes. Estos incluyen 3 indicadores para toda la comunidad: variantes de preocupación, rastreo de ingresos a emergencias relacionados con COVID y un indicador que mide las tasas de casos en las áreas donde las admisiones a urgencias son más bajas. También hay 4 indicadores específicos por sector con respecto a los brotes. Estamos monitoreando activamente nuestras señales de alerta temprana y en los casos en que indiquen una área de preocupación, consideraremos oportunidades para fortalecer nuestros esfuerzos de preparación, refinar estrategias, implementar medidas de protección adicionales y o alentar a nuestros residentes a tomar medidas sensatas para protegerse, entre otros. Como puede ver, para esta semana, todas nuestras señales de alerta temprana se consideran de preocupación baja, excepto el porcentaje de especímenes secuenciados que se identifican como una variante o subvariante de preocupación que además es elevada, con un 32% de muestras secuenciadas recientemente en el condado de Los Ángeles identificadas como BA.2. Next slide, please. Al observar nuestros últimos resultados de las secuencias, puede ver que Omicron sigue siendo nuestra variante predominante, representando el 100% de todos los casos con muestras secuenciadas que fueron recolectadas en la semana que terminó el 12 de marzo. En el condado, aunque BA.1.1 sigue siendo el linaje que predomina, la proporción de casos causados por BA.2 está aumentando. Para la semana que finalizó el 12 de marzo, BA.2 representó el 32% de las muestras secuenciadas. Esto fue el doble del porcentaje identificado la semana que terminó el 5 de marzo. Como recordatorio, estos datos representan resultados de secuenciación de muestras recolectadas hace más de 2 semanas y dado que BA.2 es más infeccioso que las cepas de Omicron, esperamos que BA.2 represente ahora una proporción aún mayor de casos de COVID en el condado de Los Ángeles. Los aumentos en el condado reflejan los patrones observados en todo el mundo. La Organización Mundial de la Salud anunció la semana pasada que en todo el mundo BA.2 representó el 86% de los casos secuenciados en las 4 semanas anteriores. Y el martes, los CDC estimaron que BA.2 es ahora la variante dominante en Estados Unidos y representa cerca del 55% de los casos revelados por las secuencias en la semana que terminó el 26 de marzo. Si bien aún no estamos viendo un aumento de los casos u hospitalizaciones en el condado de Los Ángeles, Dado el mayor riesgo de propagación de BA.2, es importante que tomemos medidas ahora para maximizar la protección contra el contagio. De manera alentadora, la Organización Mundial de la Salud informó que en países con elevados niveles de vacunación, especialmente entre los más vulnerables al COVID-19, el reciente aumento de casos no se ha traducido en numerosas tasas de hospitalización o muerte. Y mientras que el 75% de los residentes de 5 años o más en el condado de Los Ángeles están completamente vacunados, hay 1,7 millones de personas de 5 años o más que aún no han recibido su primera dosis. Además, hay 2,8 millones de residentes aprobados mayores de 18 años que necesitan su primera dosis de refuerzo, cuya cobertura sigue siendo desafortunadamente baja en algunas de nuestras comunidades más afectadas. Estas brechas en la cobertura de vacunación crean mucho riesgo. Estamos redoblando nuestros esfuerzos para garantizar el fácil acceso tanto a información precisa como a lugares para vacunarse y reforzarse, reconociendo que cuando el número de casos es más bajo, vacunarse y reforzarse parece ser menos importante. La verdad es que dada la amenaza de una variante más infecciosa que circula ampliamente por todo el condado, aquellos que no están vacunados, quienes no están al día con sus refuerzos, aquellos que están con el sistema inmune débil, aquellos con enfermedades preexistentes y las personas que están más expuestas en el trabajo, en la comunidad, corren un mayor riesgo de infectarse, de ser hospitalizados o incluso morir. Tomarse el tiempo ahora para vacunarse y recibir el refuerzo no solo protege a la persona que recibe la vacuna, sino que también reduce el riesgo de una mayor transmisión en todo el condado. Next slide, please. Como se señaló, aunque las tasas de casos de COVID-19 son más bajas ahora que durante el aumento invernal en el condado de Los Ángeles, debemos estar preparados para la posibilidad de que BA.2 u otras variantes de preocupación puedan requerir intervenciones y mitigación adicionales. Como compartimos en nuestra última sesión informativa, hemos identificado 13 métricas clave que evalúan nuestra preparación en las áreas de manejo de brotes, pruebas, vigilancia, vacunas y terapias. Como puede ver en esta diapositiva, estamos haciendo un seguimiento de nuestro progreso en aquellas áreas en las que necesitamos estar mejor preparados. Consideramos que estamos listos de forma adecuada o excelente en todas menos en una de nuestras medidas. El porcentaje de residentes de 12 años o más en las comunidades más vulnerables que han recibido al menos una dosis adicional o de refuerzo. Next slide, please. La siguiente diapositiva muestra nuestro lento progreso en el aumento de la cobertura de refuerzo en comunidades de escasos recursos. Al 27 de marzo, solo el 37% de todos los residentes de 12 años o más que viven en estas áreas más expuestas habían recibido una o más dosis adicionales o de refuerzo en comparación con el 42% de los residentes de 12 años o más en todo el condado de Los Ángeles. Si bien la tasa aumentó 10 puntos porcentuales desde el 9 de enero, está muy por debajo del nivel de umbral del 45% de cobertura, tasa que representa una mejor protección tanto para individuos como para la comunidad. Como se dijo antes, Salud Pública está tomando una variedad de medidas para acelerar el ritmo de vacunación y de aplicación de los refuerzos. Esto incluye garantizar que las comunidades con recursos insuficientes y que han sido duramente golpeadas por la pandemia tengan acceso inmediato a las vacunas en lugares cercanos y convenientes. A pesar de que no hay reembolso federal por vacunas para personas que no tienen seguro, hemos podido mantener una red sólida de más de 700 puestos de vacunación móviles y fijos adicionales en el condado, donde las vacunas se ofrecen sin cargo para todos. También brindamos refuerzos en eventos comunitarios, instalamos puestos de vacunación temporales en sitios comunitarios y nos aliamos con escuelas y organizaciones para definir las escuelas que son prioritarias. Nuestros trabajadores de salud están visitando las comunidades pobres para brindar información y programar citas de vacunación y tocando puerta a puerta en los vecindarios más necesitados para vacunar en sus hogares el mismo día a las personas interesadas. Además, con la aprobación el pasado 29 de marzo por parte de la Administración de Drogas y Alimentos de los Estados Unidos de una segunda dosis de refuerzo de las vacunas Pfizer y Moderna, suministrada al menos 4 meses después de una primera dosis de refuerzo de cualquier vacuna COVID autorizada o aprobada, las personas de 50 años de edad y aquellos que se han sometido a un trasplante de órganos sólidos o que sufren de enfermedades que debilitan el sistema inmune pueden recibirla y hay una protección, ellos tienen una mayor protección y todas las personas que están en alto riesgo también tienen esta mayor protección. Urgimos a los residentes que no estén seguros de si han sido aprobados, que se preguntan si deberían recibir el segundo refuerzo o tienen dudas sobre cuál es el momento apropiado, teniendo en cuenta los futuros picos de casos, deben hablar con su proveedor lo más pronto posible. Si no tiene usted un proveedor de salud, comuníquese con el Centro de Llamadas de Salud Pública al siguiente número telefónico 833-540-0473. Salud Pública está ofreciendo estas dosis de refuerzo en varios sitios y los residentes pueden consultar qué otros lugares las ofrecen. Para encontrar un sitio cercano donde todas las dosis sean gratuitas, pueden comunicarse con nuestro Centro de Llamadas de Salud Pública, que nuevamente el teléfono es 833-540-0473 o pueden visitar vacunatelosangeles.com. Next slide, please. Volviendo a nuestro panel de preparación, aquí puede ver que para los indicadores restantes consideramos que nuestro nivel de preparación es adecuado o excelente. Continuaremos supervisándolos de cerca semana a semana y según sea necesario. Refinaremos nuestras estrategias y recursos para garantizar que estemos bien preparados para responder a la próxima variante de preocupación, aumento repentino de casos u otro desafío que pueda poner en riesgo a nuestros residentes. Next slide, please. En las últimas sesiones informativas para los medios presentamos 4 de nuestras 5 estrategias de preparación, que son vacunación, pruebas, terapias y manejo de brotes. Hoy compartiremos algunos ejemplos de cómo la quinta estrategia, la vigilancia, fortalece nuestra capacidad de preparación. Estamos utilizando la vigilancia sindronómica para rastrear las visitas a las salas de emergencia por una enfermedad relacionada con COVID. Nuestro objetivo es que el 100% de las salas de emergencia del Condado de Los Ángeles participen en este sistema de vigilancia pasiva. Actualmente, el 81% de las instalaciones hacen parte de él y nos brindan con regularidad fuentes de datos electrónicos seguras que usamos para identificar las visitas a urgencias que pueden haber estado asociadas con la enfermedad de COVID-19. Es de destacar que, como es el caso de las aguas residuales, los datos de vigilancia sindronómica pueden ser particularmente útiles cuando hay tasas bajas de pruebas comunitarias, como cuando hay acceso limitado o un gran número de personas están realizando pruebas a través de los kits que se proporcionan y que se pueden hacer en el hogar, cuyos resultados nos informan a salud pública. Hoy compartiremos 2 diapositivas que muestran nuestros datos de vigilancia sindronómica en las salas de emergencia en comparación con, primero, el promedio de casos y luego el promedio de hospitalizaciones. Esta diapositiva muestra el porcentaje de visitas a urgencias que se clasifican como relacionadas con el coronavirus, que se muestra con la línea azul, y en comparación con el promedio de casos diarios de 7 días por fecha de informe, que se muestra con la línea verde para el periodo del 1 de octubre de 2021 al 27 de marzo del 2022, que incluye nuestra oleada invernal. Aquí vemos que si bien los encuentros con urgencias, los hallazgos con urgencias relacionados con COVID-19 generalmente siguen una trayectoria similar a los casos de COVID-19, las visitas a urgencias son generalmente más altas que los números de casos cuando los números de casos son relativamente bajos, y que durante el aumento invernal, el incremento de casos relacionados con COVID-19 a las visitas de emergencia comenzaron y alcanzaron su punto máximo antes del aumento de casos diarios, lo que fue una señal temprana de incrementos de casos. La buena noticia es que a partir del 27 de marzo, solo el 3% de los casos en urgencias se clasificaron como relacionados con COVID. Esta es otra señal positiva de transmisión más baja, que a pesar de los aumentos de BA.2, todavía no estamos viendo más números de visitas al servicio de urgencias relacionadas con COVID-19. Next slide, please. Esta diapositiva compara el porcentaje de visitas al departamento de emergencias que están relacionadas con el coronavirus, que nuevamente se muestran con la línea azul, con el promedio de 7 días de hospitalizaciones diarias en la línea amarilla. Vemos aquí los mismos patrones que observamos al comparar los datos de las urgencias con los de COVID-19. El aumento en la actividad en estas salas relacionados con coronavirus precedió el crecimiento de las hospitalizaciones por el virus, y la demanda en urgencias alcanzó su punto máximo antes y disminuyó a un ritmo más gradual que las hospitalizaciones. Actualmente, el porcentaje de pacientes en urgencias y hospitales están por debajo del 5%. Next slide, please. El otro sistema de vigilancia que revisamos es la vigilancia de aguas residuales. Este mapa muestra las áreas donde 3 agencias en todo el condado realizan la recolección y análisis de aguas residuales al menos 3 veces por semana. Las áreas donde Saneamiento y Medio Ambiente de la Ciudad de Los Ángeles realiza pruebas están sombreados en rojo. Las áreas donde las pruebas de los distritos sanitarios del Condado de Los Ángeles están sombreadas en azul. Y las áreas donde los distritos municipales de Agua de las Vírgenes realizan estas pruebas están sombreadas en verde. Los bordes negros muestran los límites de nuestras áreas de planificación de servicios. Como puede ver, los sistemas de alcantarillado, que cubren 7 de nuestras 8 áreas de planificación, contribuyen a las pruebas de vigilancia de aguas residuales. Actualmente no hay pruebas de aguas residuales en el área 1 del Valle de Antílope. Hay varias otras áreas que no están representadas debido a una variedad de razones. Por ejemplo, el área puede tener su propio sistema de saneamiento pequeño que no es parte del sistema de alcantarillado. Un municipio que pueda que no tenga la capacidad o ha elegido no participar en el sistema de vigilancia. El área puede recibir servicio de los sistemas sépticos, o puede que sea en un área silvestre. Los datos de las pruebas de aguas residuales en el Condado de Los Ángeles complementan los datos de nuestros otros sistemas de vigilancia de COVID-19, incluida la secuenciación y la vigilancia sindronómica. Las pruebas de aguas residuales pueden identificar la presencia del virus SARS-CoV-2 emitido por personas sintomáticas y asintomáticas, y a diferencia de nuestros métodos de vigilancia, no requieren que alguien se haga la prueba de COVID. El análisis de las aguas residuales puede ser particularmente útil en el caso del acceso a las pruebas para detectar el COVID, en caso de que el acceso a estas pruebas no sea fácil, o que no estén siendo utilizadas. Actualmente se puede hacer la prueba en muchos lugares en el condado de Los Ángeles. Sin embargo, a medida que más residentes usen juegos de prueba se los hagan en el hogar, el análisis de las aguas residuales podría convertirse en un complemento más valioso para nuestros otros sistemas de vigilancia. Next slide, please. Las siguientes 3 diapositivas muestran resultados recientes de muestras de aguas residuales en comparación con los casos de COVID del condado de Los Ángeles de las 3 entidades que recolectan y analizan estas aguas residuales. Los resultados de los 3 sistemas de alcantarillado que se incluyen en las observaciones son consistentes con los hallazgos de nuestros sistemas de vigilancia y ninguno de los descubrimientos sugiere señales preocupantes. Hay varias limitaciones de datos para tener en cuenta. Primero, cada una de estas entidades utiliza diferentes métodos de recolección y muestreo, por lo que los resultados no son comparables. Además, no reflejan resultados en tiempo real, ya que las últimas mediciones de concentración son de hace unas 2 semanas. Y finalmente, dado que se presentan datos de análisis únicos, puede haber una variación significativa en las mediciones con base en datos individuales, deben interpretarse con precaución. Nuestra primera diapositiva muestra los resultados del Distrito de Saneamiento del Condado de Los Ángeles, que cubre las áreas del sur, sureste y este de Los Ángeles. El sombreado gris representa el promedio de 7 días de casos nuevos en el condado de Los Ángeles desde el 20 de abril de 2020 hasta el 16 de marzo del 2022, y la línea azul muestra la concentración de SARS-CoV-2 en aguas residuales durante el mismo periodo. Puede ver que los resultados de las aguas residuales generalmente siguen los casos, y en este momento no estamos viendo una concentración significativa de SARS-CoV-2 en las aguas residuales de esta área. Next slide, please. Esta diapositiva muestra los resultados de la Agencia de Saneamiento y Medio Ambiente de la ciudad de Los Ángeles, que cubre parte del condado central de Los Ángeles, partes del Valle de San Fernando y el oeste de Los Ángeles. El sombreado gris representa el promedio de 7 días de casos nuevos desde el 20 de septiembre de 2021 hasta el 16 de marzo de 2022. Y la línea naranja muestra la concentración del SARS-CoV-2 en aguas residuales durante el mismo periodo. Como puede ver, a principios de diciembre de 2021 comenzamos a ver un aumento constante en la concentración de SARS-CoV-2 en las aguas residuales, que fue seguido cerca de 2 semanas después por un aumento correspondiente en los casos. Por lo tanto, los datos de aguas residuales proporcionaron un indicio temprano de un posible aumento de transmisión. Se ha observado mucha variación en la concentración de aguas residuales durante las primeras 2 semanas de marzo. No está claro si esto muestra que en las últimas semanas esta ha aumentado, aunque cabe señalar que la concentración media de la segunda semana de marzo fue inferior a las observadas a principios de este mes. Continuaremos monitoreando, y si seguimos viendo incrementos, esto puede alertarnos de forma temprana sobre casos que podrían aumentar pronto. Next slide, please. Esta tercera diapositiva muestra los resultados del Distrito Municipal de Agua de Las Vírgenes, que cubre parte del Valle Oeste. Muestra los casos comparados con la concentración de aguas residuales desde el 27 de enero del 2022 hasta el 17 de marzo de 2022. A medida que disminuyeron los casos, la concentración de aguas residuales sigue un patrón similar, aunque ha habido varios aumentos pequeños en la concentración de aguas residuales, incluso a mediados de marzo. Este distrito es pequeño y no hay suficientes datos en este momento para sacar conclusiones definitivas sobre posibles aumentos. Continuaremos monitoreando los resultados de este distrito junto con los datos de las otras 2 agencias que realizan pruebas, y consideraremos cualquier hallazgo notable relacionado con los descubrimientos hechos con base en la secuenciación, datos del Departamento de Emergencias y otros esfuerzos de vigilancia. Next slide, please. Si bien somos afortunados de que nuestros casos, hospitalizaciones y muertes sigan siendo relativamente bajos en el condado de Los Ángeles, la situación internacional merece atención. Merece atención y las condiciones cambiantes en todo el mundo requieren atención. Según la Organización Mundial de la Salud, por primera vez desde enero, los casos de COVID en todo el mundo aumentaron durante 2 semanas consecutivas en marzo. Como puede ver en este mapa que muestra el promedio de casos diarios por cada 100,000 habitantes, los casos de COVID-19 están aumentando en varias regiones del mundo. Algunas de las áreas que están experimentando las tasas más altas, que están sombreadas en púrpura, incluyen Australia, partes del Pacífico Occidental y gran parte de Europa. La Organización Mundial de la Salud señaló que BA.2, que es más contagiosa que BA.1, está arrasando en el mundo y que los aumentos en los casos pueden considerarse en el contexto de una variante que se propaga más y el levantamiento en muchos países de las medidas sociales y de salud que ayudaron a disminuir el COVID. Lamentablemente, la Organización Mundial de la Salud también informó la semana pasada que algunos países siguen experimentando sus tasas de mortalidad, elevadas tasas de mortalidad desde el comienzo de la pandemia, lo que según señalaron refleja la velocidad con que Omicron se propaga y el mayor riesgo de mortalidad entre los no vacunados, particularmente entre los adultos mayores. Por esta razón, continuaremos observando de cerca nuestras señales de alerta temprana y las medidas de preparación y cuando sea necesario ajustaremos nuestras estrategias para abordar áreas de preocupación moderada o elevada. Next slide, please. Dado el aumento de casos en todo el mundo, el incremento de casos en algunas partes del país y la mayor circulación de BA.2, este es un momento apropiado para que usen todas las herramientas disponibles para acrecentar los niveles de protección que pueden disminuir el riesgo personal y comunitario. Recomendamos 4 acciones sensatas para frenar la propagación de BA.2 que las mostraremos en la siguiente diapositiva. Next slide, please. En primer lugar, como se señaló anteriormente, recomendamos enfáticamente que cualquier persona que no esté completamente vacunada y con refuerzo obtenga su serie primaria y dosis de refuerzo lo antes posible. Nuestros datos locales, que son consistentes con los nacionales, muestran que estar completamente vacunado brinda una fuerte protección contra el COVID y que las personas que están mejor protegidas contra la infección y la enfermedad grave del COVID-19 son aquellas que se vacunaron por completo y recibieron un refuerzo. Por ejemplo, durante la semana que finalizó el 18 de marzo, las personas que estaban completamente vacunadas, pero que no habían recibido refuerzos, tenían cerca de 3 veces menos probabilidades de ser hospitalizadas con COVID-19 que las no vacunadas. Quienes estaban completamente vacunados y tenían una dosis de refuerzo, estaban aún más protegidos y tenían aproximadamente 6 veces menos probabilidades de ser hospitalizados contra COVID-19 que los individuos no vacunados. Se necesita tiempo para desarrollar la inmunidad dada por las vacunas y las dosis de refuerzo, así que vacunarse y recibir el refuerzo en uno de los puestos de vacunación que tenemos en lugares cercanos y muy convenientes para que vaya y se ponga estos lo más pronto que sea posible. En segundo lugar, si no puede vacunarse por razones médicas o porque su cuerpo no puede generar una respuesta inmunitaria adecuada a las vacunas, aún puede estar protegido. Debe preguntarle a su proveedor médico si es usted un buen candidato para recibir Evusheld, un nuevo tratamiento para personas mayores de 12 años que puede prevenir el COVID-19. También hay varias terapias disponibles que pueden reducir la enfermedad grave de las personas que han sido infectadas con COVID-19. Este es el momento de averiguar ahora si está entre las personas que han sido aprobados para recibir las nuevas terapias y tener un plan para acceder a estos medicamentos. Es justo ahora la mejor oportunidad para discutir con su doctor si puede acceder a una de las nuevas terapias y en caso de que su resultado sea positivo. Y si contrae el virus, pregunte de inmediato si es apropiado que reciba estas medicinas. Otro paso importante que puede tomar es adquirir los juegos de prueba de venta libre que puede administrarse usted mismo en su hogar. Para solicitar al gobierno federal hasta 2 juegos de 4 pruebas caseras sin cargo alguno, puede ir a www.covidtest.gov. Si tiene seguro de salud, puede recibir 8 pruebas gratuitas en el hogar cada mes para cada miembro asegurado en su hogar. Obtenga estos kits ahora para que pueda hacerse la prueba fácilmente si se siente enfermo. Si estuvo en contacto cercano con alguien que dio positivo o si se reúne con personas con un riesgo elevado. Cuanto más rápido sepa su estado, menos probable es que se infecte a otros. También puede hacerse la prueba en uno de los muchos sitios de prueba gratuitos ubicados en todo el condado. Visite la página web www.ph.lacounty.gov/COVID test para obtener información y enlaces a sitios de prueba. Y la acción final que puede tomar es continuar usando mascarilla en lugares públicos, especialmente si usted u otras personas con las que estará en contacto no están plenamente vacunadas, como son ancianos, tienen su sistema inmune débil y sufren de enfermedades preexistentes graves. El uso de tapabocas es una de las cosas más fáciles y efectivas que podemos hacer para protegernos a nosotros mismos y a los demás. Y por supuesto, si está enfermo, dio positivo o estuvo expuesto a alguien con COVID-19, quédese en la casa y alejado de los demás para evitar que el COVID-19 se propague en los hogares, los lugares de trabajo, las escuelas o nuestras comunidades. Si todos tomamos estas medidas, estamos seguros de que podemos continuar reduciendo la propagación en todas las áreas del condado. Muchas gracias y nos vemos en la próxima entrega. Muchas gracias.
Thank you so much, Monica, and thank you to everyone who joined us today. Any additional media questions can be directed to our press inbox at media@ph.lacounty.gov. Thank you once again, and we'll see you next week.